on this episode of A Tale of Two Hygienists.
What is your role in the practice? But we go a little bit further than that, and we ask them to ask the dentists that question. What do you think my role is? And we get them to ask their patients the same question. What do you think my role is? And you know what? Each of those three come up with different answers consistently. So if you have the patient, the dentist, and the hygienist all thinking the hygienist should be doing something differently, that's your starting point. So the first thing we need to do is start measuring our success. And if once we start to do that, then we've got a baseline. So we know, right, okay, what's working, what doesn't work. And then we can start to try and tweak what we're doing and start to improve those figures by doing different things or doing things in a different way, speaking in a different way.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, episode number 515. I'm your host, Andrew Johnston. Thank you so much for being with us today. Great guest. We're actually going to jump right into it rather than doing a separate intro interview segment. Our guest today is Tim Ives. Tim, thank you for being here.
It's my pleasure. Thank you for inviting me, Andrew.
So I didn't tell Tim what we're going to talk about beforehand, listeners. So this might be either the biggest catastrophe that ever happened in podcasting history, or it's going to be really amazing. So Tim, this is what I'd like to do. So your classes that you guys have had at O'Hare University, like, you guys have been very kind to me. You've invited me on to talk with the students. And I love these environments a lot because knowing that there are people out there in this world who are just like next level thinkers, and the fact that you guys get to put these people together, and I go into these things, like, think I might share something, and I end up learning so much more than I think I actually shared. And so I love these things. But what happens is your class usually sends me a list of all the questions that they're going to ask me beforehand. And I thought that I would turn the tables on you and ask you some of the questions that your classes asked me, and now I'm going to ask you. So
Right.
that's give me the good ones. Yeah. So here we go. First of all, Tim, is this your fifth time on the show?
It's
Listeners,
been
if you haven't listened to the rest of the one that is still the most popular, I can't remember what we titled it, but it was like basically is sugar poison, or maybe it was honey or something. We talked about something. That one is still one of the most popular episodes that we've ever done. Listeners, if you haven't listened to, I'll put some links in the show notes and go back and listen to those episodes because they're really good.
Yeah.
All right, here we go, Tim. Here we go.
Okay. Far away, Andrew.
All right, so okay, we'll ease into this one. So looking back at your career, what surprises you the most?
But if we're talking about dental hygiene specifically, that's probably what I've done the bulk of my career doing. I would say the biggest surprise is how little has changed. And yeah, how little has changed, and how disease is increasing pretty much across the board. In the dental profession, we've got two things that we need to sort out. Essentially, I mean, if you take oral cancer out of that equation, we've got dental caries and periodontal disease. That's it. How many of the medical profession got to sort out? We've got two, and
That's
we've
true.
failed miserably. And dental hygiene and dental therapy are meant to be there to prevent those two diseases. That is our goal. Not clean teeth, make people healthy, prevent disease. And disease is increasing. So who do we blame? So there's my answer, Andrew.
Okay, well, no, we're gonna piggyback on that because I'm curious how much of the things aren't changing is our fault. How much of that is internally? So for context of this, when I was scrolling through one of our Facebook groups again just this morning, and there was someone that had a license plate that said hygienist, and they said, "Okay, who in this group has this one?" And someone's like, "Oh, it's me." And then everyone else is putting up their license plate numbers, and it's like tooth scaler was one of them, or tooth cleaner, or RDH, or something like that. They have all these different ones, and to me, I feels like sometimes we're shooting ourselves in the foot a little bit and saying, "Hey, we're distilling ourselves down to this one particular task of cleaning teeth." So is there a chance that it's our fault, or is it a chance that the public just doesn't like us, that that's their fault? Where are we missing the boat here?
It's a great question. And we ask our questions a lot. Well, we ask our students, sorry, a lot of questions related to this topic. What is your role in the practice? But we go a little bit further than that, and we ask them to ask the dentists that question. What do you think my role is? And we get them to ask their patients the same question. What do you think my role is? And you know what? Each of those three come up with different answers consistently. So if you have the patient, the dentist, and the hygienist all thinking them thinking the hygienist should be doing something differently, that's your starting point. We have to get it across the board so that everybody understands what the hygienist's role is in the practice, and everybody considers that this is what the hygienist should be doing. So, so that's your starting point. You can't move until you've got that agreement between those three parties, can you? And so, yeah, I think hygienists are shooting themselves in the foot because when asked that question, the answer should be, in my opinion, and I'm as guilty as anybody here, by the way, um, to make patients healthy or healthier than they were before they came to see me. If I can carry on talking,
Yeah, yeah,
going
yeah.
going back to dental school where it all starts. Do we in school do we teach our students to make patients healthy? Is that our number one priority, or do we? It's like if I can use an analogy, if when you get taught to drive a car, you don't say, right, okay, this is the day of your test. What I want you to do is I want you to show me how to put it into gear. Brilliant, you've passed. Now show me how to turn the steering wheel. And we have this similar approach to dental hygienists and dental hygiene training. We don't get them to drive the car. We don't get them to make the patient healthy. It doesn't matter how you do it. If the end result is healthy patient, cha-ching, result. And I think we focus too much on the process and not enough on packaging it all together.
You had an interesting sound effect there, cha-ching, and I'm curious if
It's
in
starting
this.
to feel like a rant, by the way.
No, no, that's what the show is, like, in its best form is ranting against the system. That's what we do here. Um, in this scenario where we have, the different parties in the office trying to define what the role of the dental hygienist is there a way, or are you seeing that from maybe the owner, practice owner, dentist side, that they see a model of dental hygiene that is doing prevention the way that it should be, preventing disease, that is also bringing in revenue to support the practice? Or
I
are
mean,
those also kind of at odds?
yeah, I mean, you know the answer to that question yourself. You're trying to square a circle, aren't you? In that you can't mix business and healthcare. Those two things, it's like putting oil and water together. They don't go. You can create some sort of match where you get a muddled output, but you can never get a perfect situation when you're costing healthcare. I was lucky enough to be in the Royal Air Force for 22 years, and most of that time I was a hygienist, and I never once had to discuss money with my patients. Could do whatever I wanted, get them back as many times as I liked. What a shock it was when I went into civilian life, into private practice, and had to start giving people invoices to pay for my time. And that changes your thinking as a clinician. Because the moment you start to make assumptions about what people can afford, what they want to pay, and what the bottom line is, then the healthcare is not as good as it could be, as it was. And I think, and added to that equation are corporates, because they've really negatively affected the role of the hygienist in the practice and pushed them to become more of an aesthetician, really, to make people's teeth whiter. Yeah, that's another story. That's another topic. Talk about an hour on
What
that.
no, well, I'm interested in this 'cause I think that you and I probably have a little bit of different, one, maybe a definition of corporate. I don't know what corporate is for, I think we talked about this, before, but,
Groups.
like, corporate in certain parts of the US are even different than other parts of the US, right? There's not all the it's kinda hard to kinda, bottle them in, but I would like to push back a little bit and get your thoughts on this. One of the benefits that I see in corporate or group dentistry is more systematic, or trying to think of, there's so much underdiagnosing happening in private practices. And I've seen it everywhere I go, no matter where, what part of the US, anything like that, chronically 10% perio, 12% perio. But now in corporate, since we know what the standards are, we are getting closer to that 30 to 50%, perio diagnostics. And therefore we are doing, interventions and therapeutics based on those ones. And so we see a better, I would say, compliance when there is a system set up that drives or motivates or incentivizes the hygienist to be doing the right thing. Is there not some benefit in that regard?
No, because dental health isn't getting, people aren't getting healthier. People are getting more diseased. We're getting more and more my term of a corporate is a group. So a group of practices owned by a company. And I completely agree. There are good ones and there are bad ones. Um, but if that was the case, people would be getting less disease. And the statistics are telling us that people are getting more disease. And we're getting more and more corporates. I know that's not a causative and a causative thing. It's correlated, but I think it's a sensible correlation. If you have more and more group practices and more disease, it's like more and more sugar and more heart disease, isn't it? You put the two
I,
together.
yeah, I mean, I'm definitely there with you on a lot of this. I think some of this is, and this is where I don't have any answers. I don't know where studies come from necessarily all the time. Like, who's doing the reporting and how's that reporting happening? And is there are we more accurate with our reporting now than we've ever been? Is there all those different questions that everyone always asks about? Like, I'm not unhappy with our, our methods of gathering, research and data, but I'm curious if a lot of this is, yeah, for so long we underreported all of it, and now we are getting closer to actual real reporting, because we're being mandated to do so. Is there something there? But all that, though, you're right. All that is kind of beside the point because it's still not preventing. Now it's just treating. So whether or not it's out there or not, it doesn't matter. We still have it
Yeah,
at an
I
alarming
think
rate.
there's what is happening is we're getting a bigger and bigger disparity between the rich and the lower socioeconomic groups. So the statistics are skewed, probably because there's much more disease now in the people that have less money. And I don't necessarily think if that's a financial divide. I read a great paper. John, you heard of John Featherstone?
Yeah.
Yeah, great cariologist. He wrote a paper many years ago. He did a research project looking at why lower socioeconomic groups have more dental caries. And I think if you ask not 10 people, 9 people are going to tell you that it's because their diet is poor
Mhm.
compared to, and the research will tell you that they live in food deserts, those people. Um, but what he discovered is it was the stress that was affecting tooth development.
Oh,
that
interesting.
made those teeth more susceptible to caries. And then when you put the diet on top of that, where they're going to have more sugar, then you've got a, the perfect storm, haven't you? But then the initial thing was the high cortisol levels because they were stressed all the time, living from hour to hour, that their teeth weren't developing as well. So, so the real solution to dental caries is to remove poverty, to remove their stress.
So just do that real quick, and then just that, then we'll fix it. That
Yeah.
seems will also probably yeah, that'll help with like heart disease and other things. It'll be very fascinating how we can solve the world's problems by removing poverty. Obviously, that's not ever going to happen, right? So where do we need to start? Where do we need to refocus our efforts and change kind of what we can change in our own little parts of the world?
I think we need to get dental hygienists out of the dental office. We need to put them on the high street, encourage them to open up their own little offices, just like a solicitor, where you pay for their time, not for what they do. So you'll go along, have a chat with a hygienist, and they will give you all lots of sensible advice. And these hygienists won't just be educators; they will be specialists in behavior change. So they'll have studied a bit of psychology, and then so they understand how people's brains work. So as well as giving them the advice, they'll be able to help them change their behavior. And I think the solution to dental health is not treatment, it's behavior change. So if you can imagine an army of dental hygienists on the high street, and you're just paying them money to give you advice, but the psychology added on, I think then you would start to see a change. Get them out the dental office is my philosophy.
There's a gosh, I'm trying to remember. You'll probably recognize who said this. I can't think of it was off the top of my head. But they had this theory, this idea. Now, obviously, we don't probably have the populations to do it, but having assignments, right? So, okay, Andrew lives right here in Land O'Lakes, right? And he's responsible for these 12 neighborhoods around him. All the people's dental health is his responsibility. How do you feel about that kind of a model where there's like, okay, like we have to have people that we are responsible for that we don't have to wait for them to come to us. We have to go to them and we have to intervene on their behalf.
Just explain that a little bit more.
So if there were, let's say in these 12 neighborhoods, we have, I don't know how many families, we'll say I have 1,500 patients are assigned to Andrew. And I had to keep the records and do all of these things. And we are measuring health outcomes within these populations. And there's an unacceptable amount of health and I don't know, disease. I don't know. I don't know exactly how we would do it, but just
Yeah.
the idea that if it's going south over here, it's because Andrew's not doing his job over here, and he can be held responsible for then everyone else's health. And then kind of the opposite's true is like, okay, well, if things are getting better. It's because people are listening to advice and doing preventive things and kind of along those lines.
Yeah, I think it's great. And I think you could incentivize Andrew as well by saying that if that population was getting healthier, then Andrew was going to be earning more money. How,
As
how
long
many,
as he kept
if you,
records accurately.
we asked a lot of our students, all I'll just explain to the listener, all of our students most of our students are practicing hygienists. And we asked them, how successful are you? How many of your patients get healthier when they come and see you? Now, the vast majority, well, some really pluck figures from the air and say 80%. Well, I, I reckon in a good year, I would probably do 10 to 15% of my patients will probably get healthier, if I'm being really honest. But the point is, A, they're not aware. Most of them are not aware. So they don't measure those statistics. And the other point is, if you were going for an interview and the person said, what percentage of your patients get healthier? And you said 10 to 15%, the chances are you wouldn't get the job.
No,
And
no.
another thing, if your patient were going to come and see you and say, right, I want you to, $1,000 treatment plan. You've got serious gum disease, we need loads of work. And the patient says, well, what percentage of the patients that you do this to get better? Significantly healthier. And you said 10 to 15%. That patient's going to turn away and walk out that door. So the first thing we need to do is start measuring our success. And if once we start to do that, then we've got a baseline. So we can know, right, okay, what's working, what doesn't work. And then we can start to try and tweak what we're doing and start to improve those figures by doing different things or doing things in a different way, speaking in a different way. You know, the classic pie chart that we see every time we go to one of those conferences about the time that is spent divided up with a patient hour.
Mhm.
And usually about 45% of it is treatment, isn't it? And about 5 minutes is communicating with the patient. I reckon if you did that plan that I was just discussing, eventually that 75% would be talking to the patient, because you would discover what makes people healthier is when you sit down and talk to the patient, not when you start operating on them, because that behavior change has to come from the patient. And the only way they're going to get healthier and not keep coming back to see you is if they start changing their behavior, what they're doing when they're at home, be that their diet or be it cleaning their teeth or whatever it is. And I think that way you would actually start to create a methodology to measure success, which is what we need.
I'm curious on all right, we're gonna go on a little bit of a backstory here. Sorry, my brain just every time I talk to you, like all these things get like dredged up. So I worked in a practice for about 10 years, and it was, in my opinion, one of the best, results oriented, focusing on health, measuring health outcomes, kind of it's like situation that someone could be in as far as like larger corporate stuff can be. And I would go in, we did 10-hour shifts, and if I had, 10 patients in a day, I can maybe get one of those patients to really invest back into that kind of a conversation about themselves. And I'm wondering, and we never measured this because it wasn't something I think that anyone thought about or probably even cared about. But if we were saying, okay, a successful hygienist is able to get 35% of their patients healthier in a year in, year out scenario. And we have the measurements to kind of verify that that's accurate. At what point does the onus have to be on the patient to participate in those types of conversations? And is it then one more step? Like if I'm just not a good communicator, I'm not extroverted at all, I'm very introverted, I don't like talking to people that much. Is that a responsibility of a dental hygienist to be a good communicator? Because I think I don't want to say it's an unfair thing to ask of a hygienist, because sometimes some of us are just very mechanical and we just kind of go in and do the thing. But are we saying that if you are not a good communicator, then you'll never get the health outcomes that you need?
Yes, definitely. Your number one thing, the number one thing for judging whether somebody is suitable to become a hygienist is their communication skills. That's not to say they can't be improved radically, but your starting point is you need to be able to communicate. But there's just rewind a little bit, because there is a get out clause in that 35%. Because the first question you will say to the patient is, right, okay, what do you want me to do? What is your goal in this relationship? And if their goal is they want to come and see you every 6 months and they want their teeth cleaned and they're not interested in getting healthier, that's fine. You'd exclude them from your list because they've told you they don't want to get healthier. But the patients that are invested and they do want to get healthier, they're the ones that you include. And even the ones that are challenging to communicate with, you have to include them because that's your skill. And then you have to just get better. You have to go back to school, learn about behavior change and psychology and how to get inside people's heads and all the different methods that you can use for behavior change. And it's a bit like, I don't know, any skill. Once you start investing in it, then you become a lot better at it. I asked this question with my students last week. I said, how easy is it to take a theory out of a book and put it into practice? Something like motivational interviewing. How easy is it to do that? And it's really difficult. Even just starting by asking open-ended questions to people, they have to start really learning those skills by putting them into practice and keep on using them, and they get better and better and better. Yeah, so I think it is on the onus as a hygienist to be a good communicator. Number one priority. Hand skills and all of that, I would say, are secondary to that.
That is so incredibly fascinating. I think a lot of hygienists probably would not agree with you on that one. And I love that idea. And it's interesting. I don't know how many hygienists I've hired now in my time. I mean, hundreds. And one of the things I'm always looking for when I'm doing some background is, were you in like the service or hospitality business at some point? Were you a barista? Were you a bartender? Were you something that's going to be showing skills of having good communication usually? Can you multitask? Can you problem solve? Can you do all of these things? If there was a requirement for an assessment prior to hygiene school to because a lot of our prereqs, we do have like psychologies and sociologies and stuff as prerequisites to even apply for the hygiene programs. And those are all great, but there's not a prove it model. We do have, I remember when I went, again, this is a while ago, I don't know if they still do this, but I had to do like a spatial awareness, and it was a hands-on using mirrors and saying, okay, if this was folded this way, what would that look like? Some sort of a test where I could, kind of demonstrate that I have the ability to, you know, think in the abstract, I guess. They don't have those models for communication. And how amazing would that be is if you have to score a certain amount as a pre-assessment to even get into the hygiene program. But what you're talking about though, Tim, is changing the whole mindset of what our profession even is. I think that people think of it as a job. I think that people really do think of this as being just like the barista, just like the bartender, just like we're going to go in, we're going to clock in, we're going to do the physical part of this job, not emotionally investing and not really looking at this as like being like, I'm the professional. I just work in a professional setting. I think that's how they look at it.
Yeah, I think a lot of that is down to school. I mean, I think one of the things that we do better in UK than you do it in the States is that we have interprofessional education. So most of the hygienists are at university, and they're sitting in the same lectures with the dentists, and so they really do. This hasn't been going on a long time. This has just evolved in the last 30 years. And I think if you're training with the people you're working with, then I think that brings professionalism, and I think that brings more more of an idea that, yeah, okay, we're in this together, and this is a team, and this is a highly professional, important role that we have, responsible role. And I think, but I agree with you. I think there's 20-25% of people that are out there, and they're doing everything they possibly can. They're going to all the courses, they're doing all of the continuing education they can. And then I guess it's like every other job, that there's going to be 25% at the other end who are just looking to pay their salary and get by, and they're not interested in doing any of that. So, but I think it helps if you have interprofessional education, the starting point.
From all the stories and stuff that you heard from people in the US, because I would imagine you've never actually worked in a practice here, but you've very, like, you have a lot of contacts here. Do you feel like the dynamics within an office in the UK is drastically different also because of that? So, for example, here in the US, it does feel very, top down, owner dentist, they tell you what to do and you will only do that. And there's not really that much like back and forth collaboration unless the hygienist is everything you're saying, a good communicator, someone that is willing to, kind of push back a little bit, create, meaningful bonds with the owner practice or the practice owner and the dentist, and kind of get their buy-in, things like that. And then it ends up being more of a team kind of scenario. But do you think the UK is kind of already pre-positioned to be kind of a better space in that way? Or is it also kind of top down? The doctors say, hey, you will do this.
it changed when direct access came in 25 years ago. So now hygienists, pretty much like Canada, can open their own dental practices, and so much so that the hygienists can now be the boss. So there's hygienists that own practices and they employ dentists. And the other thing that really changed it significantly, you can have a huge practice where you've got all the specialities, hygienists and therapists, and the patient can choose. They walk in the door and they can choose who they see first. So if they want to see the hygienist first, they can. And the dentist, that's the point with the hygienist, and the dentist has nothing to do with that. Obviously, the hygienist is trained to diagnose and treatment plan. So they see anything that the dentist needs doing, they're sending them on to the dentist in their practice. So it hasn't decreased the workload, it's increased it, because everybody's cross-pollinating and the patient has more choice about where their starting point is in that practice. So yeah, it's I think that has really helped. And there's still the classic practices that are of old, where you have the situation where you have the dentist who's the practice owner and what he says goes, but they're getting less and less, and you're getting less and less good hygienists working in those practices. And people aren't stupid, and they vote with their feet, don't they? So yeah.
Did that change? I would imagine that there was the same fear that we have here in the US where, heaven forbid, we let, the hygienist own a practice, kind of in all states. Within some states we can, but
Yeah.
because like you said, the workload's gonna decrease, or
Safety.
yeah, safety's another one, right? Like, oh my
This
gosh,
is
we're gonna
this is
kill
really
somebody or
funny.
overlook something. Yeah.
So we have the British Society of Dental Hygiene and Therapy, and we have the British Dental Association. When this came about, we said, right, we want to give patients a choice, and we want to allow hygienists freedom. The dentists fought it tooth and nail.
Of
They
course.
didn't want it to happen, and so it went to court in London. And the argument from the dentists is that we wouldn't be safe. So, of course, the barrister representing the hygienists said, well, show us your evidence that hygienists aren't as safe as dentists. And it's the opposite. Hygienists are much safer than dentists. And the classic example is our insurance is much lower. So they lost.
I don't think that's the pathway for us to get that going on here. That sounds not simplistic. I'm sure that was very hard, but it's just like that. That's definitely not going to be the case here.
That's how it happened.
So that was one question. Your career. And as is classic in the times I've been with your classes, we never get through all of the questions. So I have two different lists. I have one that has 13 questions, and the other one probably has at least 10 or 11 questions. So we didn't get to any of these ones. Tim, I wanna highlight two more things before we close out this episode. I want to talk a little bit more about the students that go through Ohio University, the things that you and Trisha are doing for them, and also, the kind of like the quality, the caliber of the hygienist that's going through these particular courses. Like, what courses do you offer? What are you trying to get them to do? I'll just highlight some of those real quick.
So we got a bachelor's program, 6 months from start to finish, open to any dental hygienist around the world who has a license or has had a license to practice. And essentially what we're doing with those people is we're introducing them to a little mini research project. That's the second 3 months where they do that. We walk them through that project. The first 3 months is we get them ready for it. So we do spend a lot of time doing little mini exercises with them, getting to think differently within their practice. And then they do a little mini research project and they graduate. Woo! So they are contributing to the research within the field of dentistry, and there's very few hygienists doing research on their own. There's a lot of hygienists doing research that are putting their name onto other PhDs, but not on their own. And then about 2.5 years ago, we started a master's program. That's 18 months, 3 modules in the classic European module, where you do a certificate, a diploma, and then the research project. And that's great fun. I teach that. And it's essentially, we're looking at oral health promotion through different lenses. So through leadership, through presenting, facilitating, and lots of interesting things like that. So from that program, we're creating little mini leaders. That then go out and they change the world. And we've got some. I mean, the incoming president of the ADHA is one of our graduates. So I mean, we started 12 years ago. We've now got coming up to 450 graduates.
Holy moly. And how much of the research that they do make it into the new publication?
Well, we've only just released the journal. So the first journal came out in July, and so we've got about 10 papers in that. But what we decided to do was to really shorten it, so readers can get hold of the full paper, but we've shortened it to 400 words. I don't think people want to read more than 400 words. I think that's maximum
Oh,
these days.
they lose their
Ideally, they want to watch
attention
a
real quick.
video, but
Yeah.
so most new graduates are gonna find themselves being published in our journal.
I love it. I love it. The last question I have for you is just, and only as much in depth as you want to go into, but I kind of would like it to be comprehensive if at all possible. Chances of Wrexham getting promoted this year. Tell me your thoughts on that happening. 4 consecutive years of promotion. That'd be incredible.
In a percentage,
Yeah, I'd like a percentage. Like, go ahead.
I would promoted this year.
This year, yeah.
I would
I mean,
say there's
they're
more chance of them going down than getting promoted, but I would say 0.5% chance of going up. Seriously,
yikes. That's not
to go from where they were to the Championship and then go up to the Premiership consecutive seasons is,
Mhm.
don't think it's ever been done. You gotta stabilize, stay in that league for a couple of years, build, and then go for promotion.
The beginning of the season, I agreed with you, but I've been watching them a lot more lately and differently. They're starting to come together. They have. I mean, sorry, our listeners don't care about any of this, but I don't care. I'm almost done with this podcast, and they can just suffer through it. But
So you better
the,
tell us we're
my
talking about proper football, not
yeah,
American
yeah.
football. Yeah.
Well, I mean, okay, yes, we're talking about. Oh, I don't even didn't say that phrase. Proper football. Okay, here we
What the
go.
rest of the world calls football.
Yes. And for the Americans, it's soccer. um, anyways, so here's the thing: they can score the goals. You look at the goal differential though. That's the problem. So they give up too many scores. But you look at the last 5 to 7 matches or whatever that kind of has changed a little bit. I feel like their defense is starting to gel a little bit more. They're starting to give up less goals. So I don't know. I'm looking at. I'm neither of us are really betting people as we discovered, but if I was to bet on it, I would probably put a good 25% chance of them getting promoted this year. I'm high on them. I'm really loving it. And
Now,
sure, they're still,
when I said
middle of the
0.5, I
pack.
was rounding you up. I would say 10, 10, 15. 10,
Okay.
15%.
Oh, hey, I'll take it. I will absolutely
Yeah.
take it. Um, Tim, you've been a huge inspiration for me throughout
Oh,
my
blood.
my journey here in hygiene, and you have been for so many people. I'm really grateful that we've had a chance to meet. There's there are people that are doing good works, and there are people that are doing good works for the right reasons, and I think that you are the latter, and I appreciate you so much. Thank you so much for being on the show. If there's a way that the hygienist listening to this or the dental professional listening to this could reach out to you, how would you like them to reach out to you?
That's very kind of what you just said, Andrew. I really appreciate those comments coming from you. Tim at o'hareuniversity.com.
I'll put
Easy.
those in the show notes. Yeah, nice and easy. Tim, thanks so much for your time.
And can I just say thank you from all of your listeners as well for the work that you've done over, crikey, God knows how many years, putting this show out. How many?
10.
How many shows have you done?
I mean, this is episode number 515, plus all the Fridays and Monday shows that we've done. I think we've done over 1,200 or close to 1,300 probably by now.
So if listeners want to get in contact with Andrew Johnson and thank him for what he's done for education, really important education, how do they get a hold of you?
tim.ives@gmail.com or whatever your email address was. That's how you guys should reach out to me. And that, honestly, that's it. I'm very grateful that I have been able to facilitate a lot of great conversation. I'm definitely not the expert. I'm not the person that has all the knowledge, and so I will always redirect them back to you guys that are the real professionals in this profession. But
Facilitators are more important than experts. The greatest facilitators are like, oh gosh, there's so many. That Carl Rogers. They've changed the way that people think because they facilitate so well. We need these people. These are really important. Don't put yourself down. Just as important as the experts.
I appreciate you so much, Tim. Thanks. You always spin it and make me think harder about what I just said. And I love it. All right. Thanks so much.
Bro, thank you. Thank you for your time.
All right, listeners, that is our show for today. Thank you so much for joining us. Be sure to reach out to all of our guests. Give us a follow on social media. Make sure you hit that subscribe button. And if you have a minute, head over to our website and sign up for our newsletter. All right, we'll see you on the next one. This has been a production of Endeavor Business Media, a division of Endeavor B2B.